in.
Open the door. Hello. I'm going to provide privacy, hand hygiene. My name is Brooklyn. I'm a student nurse. I'm going to be doing an assessment on you today. Can I verify your name and date of birth?
TC, date of birth.
Okay, I'm going to check the provider's orders. All right, so we're going to do a head-to-toe assessment. I'm going to assess your respiratory, so your lungs, your heart, pretty much everything today. Are you okay with me doing that?
Yeah.
All right, let me verify your armband real quick. Okay, do you have any allergies?
No.
Okay, do you know where you're at?
Yeah.
Can you tell me where you're at?
My house.
Do you know what the date is?
March 1st,
Of what year?
2025.
Okay. Do you know who the current president is?
Donald Trump.
Okay. Have you had any memory loss in the past few months of your recollection? Okay, and if you'll just stare behind me, I'm going to check your pupils for reactivity. I'm going to dim the lights. So he's at a, let me check it first. He's at a 5, probably about 4. Look behind me. Okay, and it constricts to a 2. Yeah, you're good. Constricts to a 2. Have you had any vision problems? Any changes?
No.
Alright, I'm going to inspect your ears. Okay. Okay. Actually. Anyway. So your ears are normal on both sides. I see a little cerumen, which is earwax, which is normal. Do you have any ringing of the ears or any changes in your hearing? Okay. And everything seems to be well aligned. Your eyes are in line. Your pupils are round, equal in accommodation to light. I'm going to assess your nose now. So if you'll lean up. Good job. All right. Have you noticed any drainage in your nose?
No.
Okay, can you open your mouth so I can see inside? Okay, you have stuff on your tongue. What is that?
Dip.
Okay, so you do dip. You do.
I do.
Okay,
A lot.
Okay, how long have you been dipping?
Since I'm in the 9th grade.
Okay, so we'll have to document that on your medical record. Okay.
I'm good with that.
When was your last dentist appointment?
A few weeks ago.
Okay. Any changes there?
No.
Okay, so now I'm going to assess your. Okay, now I'm going to it. Yeah, okay. Now I'm going to assess your fingers. I'm looking at your skin. I'm also going to check your capillary refill, and it's less than 3 seconds here. And your skin is proper for ethnicity. Okay, and you have no edema, none on his legs. Alright, so you haven't noticed any swelling in your extremities. Okay, so now I'm going to assess his heart. So I'm going to start with the aortic valve. Aortic valve. Pulmonic valve. Erb's point. Tricuspid. And the mitral. And this is also the apical pulse. Oh. Bless you. And I would count this for 30 seconds. Okay. I counted it for 30 seconds. We'll do another one later. S1 and S2 are present, and if we're listening for murmurs, we'll turn the bell. We'll turn to the bell. Now I hear no murmurs on any of the valves. This pulmonic, and aortic. Okay, and that's good. So do you have any history of heart disease in your family?
Oh no.
Okay. Now I'm going to do the lung sounds. So if you'll just breathe, take a deep breath each time I move the stethoscope. So I'm going to do the right upper lobe. Okay, left upper. Left lower. Right middle. side.
Okay.
I'm going to assess the right lower. Okay, same thing on the other side. Smooth. And that's the left lateral lobe of the lung. And I'm also going to assess, turn this way, so they can see the back. I'm going to assess the right upper, left lower. I meant right lower. Wait, hang on, I did that wrong. It's, okay, right upper, you'll have to do it again.
Okay.
Left upper, left lower, right lower. Okay, and all lung sounds are clear and all lobes. I hear no adventitious sounds, which are crackles or anything like that. Have you had any respiratory problems?
No.
Have you been coughing recently?
No.
Okay. Now I'm going to assess your GI tract. So I'm gonna act like I'm lifting up his shirt. So I'm gonna inspect the abdominal area, and his hair is evenly distributed, and I see no lesions. So now I'm going to oscillate, starting in the right lower quadrant, the right lower quadrant. I'm going to do the right upper quadrant, the left upper quadrant, and the left lower quadrant. And I hear bowel sounds, I hear bubbles, so yours are normal. When was your last bowel movement?
Yesterday.
Okay. Did you have any diarrhea, or was it hard to
No.
pass?
It come right out.
Okay. What about your urine output? Have you noticed an increase and decrease in that lately, or is it about the same?
It's about the same.
Okay. What color is it normally?
I don't know. Sometimes yellow, sometimes it's white. It's a mixture.
Okay. So now I'm just gonna palpate. Okay. And I have there's no tenderness. I feel no lumps or anything like that. Now we're going to do range of motion. Yes, we're going to do range of motion. So now I'm going to do the wrist. So if you'll, this is flexion. What is it? This is, okay, this is extension, this is hyperextension, and then this is flexion. So if you'll do it on both.
Okay.
Hyperextend, extend, and then flexion. Okay, now I'm going to test the strength, so just push back, and then do pull down, same thing. Okay. Alright, now I'm going to do, let's do the elbow. So this is flexion, and this is extension, so just push against me. Okay, and then push against me again. Same thing here. So flexion, extension, push, push. Okay. Now we're going to do the knee. So you can do it like that, yeah, I guess. So this is flexion, how he has them bent, and you're going to extend it. Okay, and do the same thing with this one. So baby. Okay, down. And then you're going to push me. Front and back. Okay, same thing, front and back. Okay, and now we need to do the...
It's only look big.
Now we need to do the hips, so if you'll stand, that way we can see. So you can do out. So this is abduction, adduction. Same thing on the other side. Adduction, abduction, adduction. So if you will push against me. Okay, do it again. Okay, I'm gonna do the other side. Let me get on this side. Okay, go. All right. And you can also circumduct, which is rotate it. You can come up, and then you can hyperextend it back too. And you seem to have range of motion and all that. Don't sit down quite yet, because I'm going to test your gait really quick. So if you'll walk back and forth, where the camera can see you, please. All right. So, and then tiptoe back. Tiptoe, tippy, tippy, tip. Okay. Have you noticed any changes in your balance or any recent falls?
No.
Okay, cool. All right, you can have a seat. Okay. So the provider has also ordered for us to do some education. So I'm going to educate you on the Glasgow Coma Scale, the Braden Scale, incentive spirometer, and turn, cough, and deep breathe. Okay, so the Braden Scale has to do with skin integrity, and that's there's three factors that affect. Well, three factors that I'm going to tell you that affect skin integrity. That's your nutrition, so you want to make sure you eat enough protein in your meals. You want to make sure that you move around frequently, because the more stagnant that you are in the bed, it can cause pressure ulcers and pressure wounds, and we don't want that. And then also be mindful of your skin whenever people are pulling you up or anything to do with picking you up. They can tear your skin really easily, okay? So that's the three factors. The Glasgow Coma Scale has to do with traumatic brain injuries, and that's how they detect how your eyes respond, how you're oriented, and your motor skills. And I've already tested all that stuff, and you're oriented, your vision is good, and your range of motion is good. And also through the incentive spirometer, you're going, here you go. Here's your incentive spirometer. You're going to inhale deeply, hold your breath for 2 to 5 seconds, and then exhale. Okay, can you repeat that to me? With words.
Oh, my bad. You gotta inhale for 2 to 5 seconds, then exhale.
Yeah, and you hold it.
Well, yeah.
You inhale.
Inhale,
and then hold for 2 to 5 seconds.
And then exhale.
Good job. Thank you. And then whenever you turn, cough, and deep breathe. Whenever you're in the bed at night, if you're having extra mucus that you can't seem to expel, I'm just going to have you turn, cough, and deep breathe.
Okay.
And that'll help the mucus and your alveoli have gas exchange, and it'll help cough that stuff up. So you'll just spit that in the little bedpan, a little sputum thing after you get done.
Alright.
And I think that I am done. So, if there's nothing else that you need from me, I hope you have a wonderful day. And now I'm going to document. Okay, bye.
Bye.